All right, good evening, everybody. My name is Kyle Magatoli from the Student Doctor Network. I am here with Dr. Emil Chuck, Director of Advising Services for the Health Professional Student Association, to talk about clinical experiences. Dr. Chuck, how are you doing this evening?
Good evening. Doing pretty well. Hope you're doing all right where you are.
Nothing to complain about that matters. All right, so any questions you guys have, please put them in the comments and we will address them, be they about clinical experiences or anything else admissions related. So, first question, this is a good one. What types of experiences are clinical?
So, obviously you would think this is an easy question to answer, but for whatever odd reason, we just have these questions about whether an experience someone does is clinical or not clinical when we're discussing them on the forum. So I think, there's a lot of us who are experts that have particular characteristics of what is considered clinical. Certainly, the easiest way that I can pretty much define to you what a clinical experience is certainly something where it is related to healthcare and is usually something where you see doctors. Doctors are involved somehow or another in the practice or in the running of a particular clinic or a space. So clearly anything that we are normally accustomed to, where we're talking about hospital-based care, that's pretty easy if you're talking inpatient or outpatient. Now, we do have opportunities where people are involved with community clinics, and whether they're free or they're remote or rural clinics, that's something that if doctors are involved in the running and the operations of that facility, that's something that's very important too. So one particular definition of a clinical experience is where you see doctors working. The other certainly is any other element of healthcare delivery, how it's being delivered. And it doesn't necessarily involve doctors. So this is where you start getting into the gray areas of whether people think that, maybe assisted living, maybe senior living, maybe hospice are places where you would basically have clinical care going on. And I think in that case, you have a patient-based definition. So where people are serving patients or patients are being cared for or managed somehow or another, that is considered a clinical experience. And then we can go a little bit more into more gray areas. Rehabilitation, for example. So if you're doing physical therapy, occupational therapy, in a way, because those are people who hopefully you consider patients. If you're under a patient sort of outpatient type service, that would be considered clinical. Now, I do know there are a lot of private clinics that exist there too for physical therapy and whatever else. And is that considered clinical? I mean, I guess, again, if they're considered patients, you probably could consider them clinical. So you would think it's a very simple, easy answer. And in fact, it's a little bit more complicated, partly because our healthcare system has become a lot more complicated than before too. So, that's one of the big questions thereafter. And I think for most people, if you want to be a doctor, you want to be in places where doctors are working. If you want to be a pharmacist, you want to go to a place where pharmacists are working. So whether they be in retail, hospital, pharmacy, wherever else, you go there. And if you see where pharmacists are working with patients or in some cases clients, that's something that you would consider clinical. Physical therapy, occupational therapy, podiatry, whatever other opportunities, you want to make sure the professionals that you're working for are actually working there and what you want to become. And you also want to make sure that whatever you do, you are working with patients, bona fide patients. Now, an example that is still very on the fuzzy side and still may or may not really be considered clinical. We've had a lot of discussion on clinical research, if you're doing drug trials or whatever else, whether that's bona fide clinical or not. And I think certainly that's an area that people really do have a debate about, because are you really treating the people that you're enrolling in a study as patients, or are they study subjects? In general, I would think they would be study subjects and not necessarily real patients. But again, the definitions are pretty fuzzy along those lines. So I like to think of it very clearly as, do you see what doctors do? Or do you really care for patients and are face-to-face with patients and get to see what their situations are and understanding is in a healthcare type setting?
Perfect. Next question, do I need clinical volunteering activities if I also shadowed a doctor or had clinical employment?
Okay. So let's break down a little bit of what I will call as clinical exposure. It is any sort of opportunity where you are working either with doctors or working with patients, preferably face-to-face. Clinical employment versus clinical volunteering has to deal with money. It's if you get paid or you don't get paid. If you shadow a doctor, I would probably consider it a little bit of clinical volunteering, because most times when you're shadowing, you're not getting paid. I know there are some programs that are out there that will pay you a stipend and you're shadowing doctors, and that we can go into a little bit later. But do you need clinical volunteering if you're also or do you need clinical employment? Do you need both, basically put? I think, first of all, I am the type of person who says, if you need money to survive and to make a living and to eat and to get clothes and to go place to place, you are not, we don't expect you to live, without earning any money in order for you to get into medical school. So do you, quote, need clinical volunteering if you also have those? I don't think you clearly need to go into poverty or to do volunteering opportunities if you have employment opportunities or if you have shadowing. But clearly, as I said, you just need to know what doctors do, or you need to know how patients are being cared for by doctors or by a healthcare team. Whether you get it by volunteering, you get it through studying because you're in some sort of a formal degree program, you get it because you're employed. It doesn't totally matter as long as you have that experience in that type of a healthcare setting.
Perfect. Yeah, breadth of experience. If you can afford it, go and get it. Any questions you guys have, again, please place them in the comments and those will be answered. Is shadowing counted as a clinical experience? Yes. Yeah.
Yes. I don't know why we still kept these questions on the forums. In terms of why is it a clinical experience if you're doing shadowing? So first of all, let me dial it a little bit back. Yes, in-person shadowing should be considered a clinical experience. When we had COVID, we had a lot of virtual shadowing. And, it's not necessarily so much a clinical experience, but it's more like, information gathering. You could read a lot of articles from us. We do a lot of interviews with people who are physicians or other health professionals, and they tell us about their journey to becoming a professional, what their daily experiences are in terms of what they do during a day or during a week to do their job. And that pretty much is what, when you're actually shadowing a physician or hopefully even taking them out for coffee and talking to them about their careers, that's what you're trying to find out and gather that type of information. And so, if you want to talk about it being a clinical experience, again, you at least see what doctors are doing, especially around patients. That would be very important. You don't need a ton of shadowing in order for you to, get at least a baseline understanding of what doctors do. And it is therefore part of a clinical experience, but shadowing in and of itself should not comprise your only clinical experience in your application. And certainly in-person is going to have a lot more importance than, seeing YouTube videos or doing things virtually. That's great if you want to do that, but, and as much as I think many medical schools are, trying to teach people to be good with telemedicine and telehealth, still need to actually face people, in terms of patients. And that's going to still be a very important part of your education. So yes, of course, shadowing counts as a clinical experience. And I still don't know why people don't accept that.
Okay, sums it up. Yeah, shadowing is also a good way to learn about how much time physicians spend charting and a little bit about insurance billing codes. All right. Does working in the back office, no patient contact, count?
Well, talking about billing codes, so this is one of those things where, we can really discuss a lot at great length about whether working in the back office or backside of the office really helps one way or another. I think a lot of people, as I mentioned before, you want to know what doctors do, or you want to know what how doctors take care of patients or be involved with patient care. So in a lot of cases, if you're doing like a lot of accounting or a lot of file sorting or whatever else, it wouldn't be given as much weight with regards to it being a quote unquote bona fide clinical experience that counts or whatever else like that. So I could certainly understand that, back office type work, people kind of, really try to avoid it. But on the other hand, sometimes that's just part of your job. If you're working, say, at a free clinic or a community clinic at the front desk, guess what? Sometimes because you're working for a nonprofit organization and, you're not fully staffed, you don't just hand over your files to someone who just exclusively works in the back office. So sometimes as responsibilities really go, you've got to have to do some back office type work. And if that's part of your responsibility, that's part of your responsibility. But again, make it very clear you got to know what doctors do, and you got to know how to work with a variety of patients that your doctor's going to take care of. So, I think for a lot of people working in the back office for medical school applications doesn't seem to carry as much weight. If you're talking about some other smaller patient clinics or private practices, it might carry a little bit more weight, especially if you're like in dental or optometry or something. And again, we don't have a lot of, there's not a lot of places that are completely fully staffed, I guess is a nice way of putting it. So if you have to do back office work, so you can better understand things like insurance, knowing how to recall patients or at least do follow-up with them, that might be okay for those of you who are in a lot of the other fields. Not necessarily medicine per se, but be very mindful of the fact that if you are going into medicine, you've got a pretty large team. You need to respect the people who do work the front desk or work in the back office too. They do play a very important and vital role. I'll also say sometimes, quote, working in the back office means that you actually get those uncomfortable conversations with patients. Again, the important part is you're actually face-to-face with patients. And if you're having uncomfortable conversations, I usually think it's centered around money or insurance. So it may not necessarily be bona fide clinical, because doctors don't usually talk to patients about their insurance. They usually leave it to someone else who's a financial counselor or someone who really engages with regards to knowing and understanding the social safety net. I would probably give you a little bit more credit if you were having those conversations with people about their insurance, their ability or inability to pay, coming up with other safety net solutions one way or another, whether it comes to transportation or housing or whatever else have you. So, there's probably some leeway on, whether you believe it or not, but as long as you're either working directly with patients or you're directly seeing what doctors do, it really will help you out there.
Again, any questions you guys have, please place them in the comments. And yeah, the back office side is a good way to learn the reality of the healthcare business in the United States. As a business, without the administrative side, everything grinds to a halt and you won't get paid for seeing patients. So it is a good experience to understand that totality of what you're getting into, if you will. Doesn't matter who I shadow.
Okay, so doesn't matter who you shadow. I guess it depends on your particular field. I would certainly recommend whatever you do when it comes to shadowing, you do dedicate at least a certain number of hours, at least like 10, if you could, to a block of your primary care specialties, whether it's pediatrics, family or internal medicine, geriatric medicine, whatever have you on those sides of the house. For dentists or for anyone who's going into dentistry, there's a lot of schools that will dictate that they would expect a minimum of like 10 to 20 hours of shadowing a general dentist. So someone who's not in like one of the big specialties of endodontics or perio or orthodontics or something, or oral maxillofacial surgery. So, in terms of who you shadow, depending on who you talk to, we all want to have a good idea. You understand what primary care physicians do. The rest is probably fine too, as long as there's a certain level of interaction with patients, if at all possible. I mean, I thank you for those of you who decide to shadow radiologists. There are probably some radiologists that actually do meet face to face with patients, and I'm not going to try to generalize everybody in that sense. But I think I see a lot of people who tend to shadow or scribe for, say, ophthalmology practices. And that may be really good because you get to manage a lot of different patients, or you get to see a lot of patients within a certain period of time. And you can kind of, navigate that. And it works really, really well along those lines. But ophthalmology is still a very lucrative specialty. And a lot of times, the pace of how you work in ophthalmology or some of these other practices where, if you want to think about the pecking order, your lives are not as hectic as you would be in emergency medicine, as another example. So I think you want to make sure you know what doctors do, but not all doctors are exactly identically the same. They don't all have the exact same like work-life balance, and they don't all interact with patients exactly the same way. They all have very similar things that they have to be able to do when it comes to handling or meeting patients, listening to their concerns, trying to come up with some sort of a diagnosis, trying to come up with some sort of a prescription plan, whether it's with medications or maybe not with medications, and maybe more lifestyle associated, knowing how to do follow-up with each of the people that you have as patients, or maybe their caregiving team. Certainly whatever conversations that have to happen with insurance, especially with prior authorizations, we can go into details about that. But everybody's a little bit different when it comes to their own way of managing their particular position on behalf of patients. So does it matter who I shadow? First of all, it matters in that you do get a broad perspective of all the different types of things that doctors do, and that includes a good sampling of your profession, of your specialties. But predominantly, your primary care specialties are going to be your more important ones, because everything relies on your primary care specialties, no matter what you do, whether it's medicine or dentistry or whatever else. So those are probably the more important things to think about who to shadow. I know many of you who probably are worried, and you want to get that very strong letter of recommendation from a physician that you shadow. Make sure that person is going to really care and mentor you, answer your questions about their career, about what's really challenging about doing what they're doing. I think it really matters who you shadow in that sense, and that the person really is willing to have an upfront, honest conversation with you, including some of the more uncomfortable topics, whether you're talking about, how do you plan for a family? How do you manage your debt? How do you move around from place to place? How do you care for your family members or your parents if they got sick? All those sorts of things. If you have someone who basically you can count on and rely on as a mentor, who can write you a letter that way because of the types of conversations that you have, the more upfront and honest conversations you get, the more meaningful I believe your shadowing and your networking are going to be. So does it matter? Yeah, of course it matters. And I hope I give you some practical advice, not only in terms of the specialties you need to be working on, but also the types of relationships that you need.
Perfect. Again, any questions you guys have, please drop them in the comments. Would being a pharmacy tech count a dental assistant and animal shelter volunteer? I would imagine those count a lot more depending on what you're applying to.
Right, exactly. So we do see a number of different people a lot of applicants who, you've done all of these other jobs, and ultimately, if we're going to use medicine, gravitated towards a career in medicine. And of course, we have a lot of people who do the other, who start pre-med and go into it and go into the other other professions as well. So we have plenty of pre-dental students, for example, that have done the pre-med track. They shadowed physicians. They did all of this stuff that they did, shadowing and working in hospitals and doing all that stuff. But something or another happened that they switched over and wanted to go into dentistry. So, things happen. And I do understand that sometimes all of these opportunities where you're meeting and working face-to-face with patients, as I said, for clinical experiences, I believe they count. And I think all of these examples, animal shelter probably a little bit more, you have to kind of really stretch it a little bit more for that, unless you're really becoming a veterinarian, in which case, of course, an animal shelter work would probably count there in that sense, because you're working with animals. Some animal shelters do have veterinarians that do obviously have to check the health of all the animals that are there. And you need your experience with animals for vets, regular domestic animal pets, as well as, farm animals and wildlife animals and zoo animals. And so we can go into all of that a little bit later. But in terms of if you're applying to, med school, dental school, pharmacy school, obviously, if you're concordant with the type of career path that you have with any of these options, then of course it's going to matter a little bit more. There's going to be a little bit more weight if you're going to be a dental student, the fact that you've worked as a dental assistant before. It's not going to be as important if you wound up going into medical school for whatever reason. But, I think some people will say that, if you know how to describe what value you had in your experience as a pharmacy tech or as a dental assistant, especially on the part where you're talking about working with patients face to face. You can help other people discover that, hey, that experience did actually count. You weren't just a pharmacy tech in the backside of the laboratory, just basically making sure you count the right number of pills and you mix the right type of formulations together in order for you to fulfill a prescription. You did talk to somebody when it comes to the medications, answering their questions, addressing whatever their concerns are, assisting with vaccinations or whatever it ever happens to be. Just depends on how you describe your experience and how much value it adds to you in understanding how to work with patients, and how hopefully those skills can help you when it becomes your turn to work with patients on your own. And or maybe you've had some opportunities to see it happen in your shadowing and other sort of opportunities where you're actually observing actual real bona fide doctors. So basically put all of those experiences, in my mind, they count, but realize that, if you want to be a physician, you can't have, your dental assistant hours are probably helpful, but they can't stand on their own by that. You got to really still do your work, see what other physicians do, and also keep building your own experience working with and talking to actual patients. So hopefully that helps out. I think it all matters because healthcare is such a complicated system. But if you want to be a physician, you got to know what physicians do.
Makes sense to me. I frequently help with paperwork at a local free clinic. Would that count?
So as I think I mentioned a little bit earlier, if you help out with paperwork, then maybe you work a little bit in the back office. You might work a little bit more in the front office. You might be working for fundraising for a free clinic. And in all those cases, is it necessarily clinical? Again, if you use the standard of, how often do you actually talk face to face with patients, or how often you see what doctors do? Maybe that's not a significant part of your experience in a free clinic. And, I think any of that experience is going to be helpful because, as mentioned before, there is a bureaucracy that comes with being involved with healthcare and being involved in community care for sure. So I think understanding the paperwork, it gives you a little bit more deeper insight about some of the challenges that exist with regards to delivering the type of care that everyone should get. So, would that count? I think in some cases it would count, provided that you understand why this is important to you. Why is it important that you understand all this paperwork, or you understand the frustration of having to do all these applications to try to get on food stamps, or get an EBT card, or all this other stuff? I think there's an element where I think if you really do understand the frustrations that our patients and our society community members have had, who are your patients, it might count, maybe not necessarily as a bona fide quote unquote clinical experience, but it could help you get a better and stronger understanding of what your community really needs and why your role as a physician is ideal for this circumstance. So, I think in terms of would that count, I guess it depends on how you talk about it, and if you gain some insight about how healthcare actually works in this country, or wherever you are, then you can give it and ascribe it some value that people would say, yeah, that would be good for you to have that insight if you were a doctor. So make sure you can tell us why that's important, and just don't help us easily discard that experience. If that really is, if you didn't really get anything out of it, then you can downplay it as much as you want to. But if it really is important for us to understand why you want to be a physician, you might as well try and talk it up, and make sure don't exaggerate its value, but make sure you have a good idea of why that experience was important for you as a future physician. And if you do that, then it might count.
All right. Yeah, it sounds like the way you're able to speak to something and its value is absolutely critical with respect to the entire gamut of these experiences. Any questions you guys have, again, just drop them in the chat. We are here to Dr. Shuck is here to answer them. I'm here to read them. All right. How many hours of clinical experience do I need? That's a good question.
Okay, so many of you are just going to worry and focus on, do I have enough hours? Do I have enough experience? Basically, frankly, and as I'm going to just tell people, you need something greater than zero. And you would be very surprised how many applications exist in every applicant pool for which the amount of clinical experience put on the application is like zero. And I don't even, and I really mean literally zero. Like they list no clinical experience whatsoever. So I will certainly tell you, you need something greater than zero. So, all right, let's just be a little bit less than flippant on that. So what exactly do you need? Well, you don't need to show us that you're a doctor before you become a doctor. That's not what we're asking for here. If you are non-traditional, there are certain things that we understand in terms of other priorities that you have on your plate, and trying to get at least enough credibility that you are really making that pivot and that transition to being a physician is going to be very, very important. I just generally tell people, based on all the experiences I've had looking at and analyzing applicant pools, for the most part, I will say baseline for almost all of the professions, a baseline is like 100 hours. And I say 100 hours is really 2 hours a week for a year. For those of you trying to apply to medical school, I raise the bar a little bit because, 2 hours a week for a year, that's really not much. And there's so many more of you, and there's more, there's a lot more that's involved with clinical experience than, just running an optometry clinic as an example. So what are we looking for? Well, hopefully, if we're looking for a baseline again is about 150 hours. So that's 3 hours a week for about a year, if you were to sort of normalize it out for an entire year. Now, as I said, that's absolute baseline. There's higher standards that I would probably suggest to you depending on, how, quote, competitive you want to be in the applicant pool. I say for a lot of people, if you're thinking about some really, high profile brand name medical schools, I will start at 250 hours. So that's 5 hours a week for an entire year. And that's like bare minimum, as I mentioned. There's plenty of people in the applicant pool who've done like 8 hours, 10 hours a week for a year. So what is that? 10 times 50 is 500 hours. There are some schools that really want to make sure you do a lot of clinical experience, so they will raise that bar a little bit more. So between 500 and maybe 1,000 hours of clinical experience. Really depends on what your life situation is. But if you really wanted a bare baseline, I would go with 150 to 250 hours if you really want to be, quote, in the competitive pool. But understand they are baseline. They are like your absolute bare minimum. And make yourself attractive by showing people you don't just do the bare minimum of anything. Clearly, hours are important, but your descriptions are just as important to sort of justify that you're learning a lot of stuff with the amount of experience and amount of time you've committed to understanding healthcare, understanding what doctors do, seeing a lot of things that doctors do other than, we round with patients, but really getting an understanding of what are the decisions they have to make? What are the things that they have to do? I certainly talked to a lot of pre-dental students back in my day, and a lot of times when they talk about their clinical experience, they basically itemize for me what are all of these different procedures they saw dentists do. And that to them justified, this is why I want to be a dentist, because of all these different things that I saw this dentist be able to do and some of the really cool things you can do with the technology. That's great. That's wonderful. There's a similar vein on that side of the house for medicine in terms of you understanding how, they work with patients. And, you may not see a lot of procedures, but you've got to get a good idea of what sort of decisions they have to make when it comes to working with patients. And the more time you have to see these patterns, the easier it is for you to basically justify that you're prepared for medicine as a career path that way. In the same way that obviously all of the other career paths, we can talk about them a little bit later if that becomes the question. So, in terms of hours, I would definitely say 100 hours is absolutely simple for most of the professions, 150 for those of you going into medicine, 250 for those of you who want like some sort of, quote, brand name school, and 500 or more if you really want to be super serious about it.
Yeah, 500's a little tougher when you're a non-trad.
Well, Well, that for traditional students, that's clearly very challenging. But they also, you have to understand there are a lot of non-traditional students that are there too, and that are applying. And again, I say that over a span of a year. And clearly, sometimes you don't have 10 hours every day or every week in order for you to spend time in a hospital. I totally get that. And that's one of the challenges that we all have, needless to say. But we try to work with that as best as we can.
Yeah, I mean, you can get there. It took me a couple years, but it's doable. So, all right, next question. If I'm interested in medicine, should I shadow a DO?
Well, I would certainly say that the trend right now is that there is a growing number of schools that are DO that are opening or have been opening over the last few years. And so if you really want to look at the numbers, the statistics, and everything else like that, DOs also are physicians, and they have equivalent standing here in the United States. It wasn't that way not too long ago, where you had separate MD, separate DO residencies. The pecking order was very clear, and like 1 in every 5 or 6 physicians was a DO. That number's to really change. It's now 1 out of 1 in 3, 1 in 4 physicians are DOs. They've unified the residency process. They just recently came out with a core united fundamental group of competencies that they want to make sure that anyone graduating from medical school has prior to starting residency. And MDs and DOs are contributed to that list of competencies as well, which, by the way, if you do get a chance, they just recently released this unified set of undergraduate medical education competencies. They come up with a lot of different things that they want graduates of medical schools to be able to do that show that they're prepared for residency. And these should be things you should be familiar with, because that's what you should know what doctors do. And that's what you should measure your education against to make sure you really are prepared for residency along those lines. So should you shadow a DO? I think it would be really good for you to shadow a DO, because that's 1 in 4 physicians that are being produced right now in the United States. Do you all need to shadow a DO if you're applying to DO programs? I mean, it'd be a very good idea if there's any real difference one way or another. I think most people know that for osteopathic medicine, you have the extra added curricular element of learning osteopathic manipulative techniques. I don't think that many physicians really use them, the OMT or OMM, that much once they graduate from school. Maybe it's like 20%, 1 in 5, maybe 1 in 6, depending on who you talk to. But because the future of the residency process is a unified process, that it will take a little bit of time, but in theory, if you perform really well on your STEP exams and you get very solid letters of recommendation, a DO can make it into some of the more lucrative and more quote unquote exclusive specialties that are out there. That's certainly not, it's not a unicorn anymore. And certainly over the next 10 years, it's going to be less and less a unicorn too. So I would encourage you to shadow a DO, even if your stats are super high, and you probably would never consider going to a DO program. One, you never really know what your MCAT score is going to be, and secondly, don't be so elitist, I guess is the nice way of putting it, because you're going to be working with DOs if you make it into residency and beyond. And just not knowing that these people are professionally trained and have an equivalent level of knowledge as you do, I think is really important for you to know.
All right. Question from Laura Turner. Hours across multiple years are okay, right? I sure hope they are.
Oh yeah, no, that's fine. Again, it's not that I don't know if that many schools really get that hard, get hardcore, like very picky about hours per year or whatever else like that. I just basically say however long that it takes you. Usually the threshold is about 150, 250 if we're talking medicine. And if you did it over multiple years because you had a life or you had school, that's fine. What's important is the hours are important, but what you learned is more important. And what you learned about what doctors do is most critical when it comes to you describing the impact of the observations that you made when you were shadowing or in the type of work that you were doing in a clinical setting. So make sure, as we tell people, yeah, numbers are important, but what you did or what you were able to learn is much, much, much more important than that.
All right, perfect. And again, any questions you guys have, please drop them in the comments. What if I work in an international mission?
Okay, so many of you who have been applying are involved or have been involved with some sort of an international mission. You know, Global Medical Brigade, some of these other organizations that have you take like a week or so in some sort of a mission trip to some country outside the United States, whether it's in Latin America or it could be in Africa, and you're working, or even the Caribbean, and you're working for about a week in some sort of a community-free clinic and just helping the physicians or whoever who are there taking care of the population of people that you're serving for. Now, if you work in an international mission, there's a few things that I will basically kind of tell you a little bit. First of all, you still need US work if you're going to be working in the United States. It's really important that you really understand the US system, no matter what you do. And for many people in admissions, we all realize that, you know, sometimes the international missions that you see because you want to see people who are underserved, under-resourced, whatever else, sometimes you don't have to go thousands of miles in order to find people who are in that type of predicament. And that's one of the things that we really try to encourage and emphasize people is like, you know, seek the stuff that's closest to you because, you know, one, it's much less expensive. And two, I think it's much more real to admissions people for various schools because you do a lot of community service in many of these medical schools there too. Now, don't take me wrong. There's some medical schools that will also do medical international missions too. And I'm not trying to exclude those or even say that they have no value or whatever else. But I think most of the people in admissions want to see you working with your local communities, that you're making a difference to people who are close by that you represent or that you have been a member of or in terms of their community before. So I want to make sure that I make that very clear. It's like, make sure you have at least some US-based mission work. If you did go on an international mission, however, one of the things that's really very important is that you do not practice as a doctor in another country when you are not licensed to do that. About 2010, the American Dental Education Association responded to a number of anecdotes that many of the pre-dental students that went on these international missions actually, you know, did work, or they were encouraged by their preceptors to do work like other dentists do, like do extractions, for example. You are not trained to do that sort of work. You are not trained to touch patients or do anything else other than possibly very, very simple, low invasive, you know, no invasive type work, like, you know, finding somebody's pulse or taking some, you know, trying to determine a respiratory rate. Something very innocuous and something that you can do without necessarily invading somebody's space or requiring a high level of certification or training. But we had a lot of stories where there were people who were pre-dental going on these international mission trips, and they were actually performing things that they should not be doing because they would never be allowed to do that in the United States. Ethical reasons and whatever else dictated that the ADEA folks came out with a statement saying, you should not be doing stuff that you are not practiced to do in the United States, even if it weren't in a country outside the United States. And do not feel pressured to do that. If you do, please report it. You know, report it to whoever the powers that be, because that's clearly not ethical. So one major thing is, please do not, you know, don't throw medical ethics out the window because you're not in the United States. So if you work on an international mission, do things that are appropriately educational, things that are generally innocuous, like you could be scribing if you were certified or trained to do any of this sort of stuff, presumably beforehand. But whatever you wind up doing, don't just, you know, don't believe that you're making a good impact in the small period of time that you're there, but you are not doing something that you're going to ultimately change the entire healthcare system in a third world country. You're not in that position to do that sort of thing. So if you work in international mission, please remain ethical to the expected roles that you need to be playing, because you are not trained as a medical student to do medical procedures. So please keep that in mind. Now, also keep in mind, we have medicine and dentistry usually are working side by side with each other. Take the time to know what the other side is doing, and because you'd be very surprised one way or another about how, people are coming to these international clinics, and, a lot of times they're in pain, but usually it's related to what's happening in their mouths. And it's quite amazing to see that actually happening. We cover that a little bit in our course that I will certainly say that we do for becoming a student doctor, looking at missions. And, probably the one that everyone has heard of is the remote area medical clinics, the RAM clinics, which originally started as international service missions and has since pretty much pretty much been serving most of the United States now. So they've gone domestic, and I don't think they do as many international service mission trips as much as they used to. But plenty of other professional societies do. If you go on an international mission, I encourage you, look up the ones that professional organizations that hopefully know how to maintain ethics, that they allow you to participate in. There are some, maybe a few medical schools that may allow you to go with their medical students and some faculty and work in some limited capacity on a medical mission trip. Be very mindful. If you have to pay a ton of money, thousands of dollars of money to go on a mission trip, I mean, you can, if that's really something that you want to do. I don't want to dissuade you from it, because, how can I do that? But I just want to keep in mind that, whatever you wind up doing, make sure you maintain, your integrity, and you don't do what, you're going to do. You don't do things that you should be doing once you are a doctor, when you are practiced and licensed to do that. Just be very careful and mindful about that. That's all I can pretty much say.
Makes perfect sense. All right, any questions you guys have, again, please drop them in the chat. And last one we have teed up. Do I need to be vaccinated? Do I need to be insured? I just hope you are anyway, honestly.
So here's the thing. This is actually a conversation that came up in a different forum. First of all, I hope you really, if you are not vaccinated, and you are considering going into a healthcare field, I really want you to sort of explore the reasons why you're doing that. And I want to make sure you get a good idea of, the background, the philosophy behind it in the first place. The fact that you and many people in this country remain unvaccinated, and you are here to care for people who are sick, means that you've put yourself at a higher risk, and you put your patients at a higher risk of contracting some sort of disease that could have been easily preventable by being vaccinated. And so, for the purposes of, the safety of the patients that you're working with, you need to really consider to be vaccinated as much as you possibly can. And I certainly understand if you have religious reasons or any other sort of personal sort of misgivings about vaccines, whatever, so often. I totally get it and I understand it, but I really want you to think about it very carefully if this is really what you want to do, because you're risking a lot by doing that. It's kind of the same, I just want to make sure you know that. We do a lot to just make sure that we keep everybody as healthy as absolutely possible. And by not being vaccinated, you really put a lot of people at risk. This goes into the question of, do you need to be insured? Now, insurance is a little bit of an interesting question, because most of the time when we think about, we've had like a couple of discussions in a different forum about whether pre-med students, when they're doing these clinical rotations or doing service opportunities, do you need to be insured? Do whatever you need to do, especially if you're talking international missions, to insure yourself in case you do get sick overseas and something really weird happens to you. You want to make sure you can get back to the United States as much as you possibly can to be treated. But in terms of things like malpractice, I don't know if pre-meds, again, hopefully pre-meds are not actually practicing to be liable for malpractice. That just doesn't quite make any sense. But do you need to be insured? I think you need to be insured as much as you are supposed to be covered by doing these types of trips. And whatever you do, and they'll have you, indemnify any responsibility that whatever the host organization is, the university, whatever, they say, no, this is, don't sue us if something happens to you. And there are many cases that if you're going on actual bona fide sponsored trips by schools, universities, and whatever else, there might be some requirement that they may have for you to be insured in order for you to participate in some sort of a clinical experience. But for the most part, most people are probably going to say, hey, if you have health insurance already under your parents or whatever else, that should work, because we're not going to have you do things that doctors, dentists, other people actually are practiced and trained to do, and thus pull out and get more health insurance, professional insurance for. So you may want to check with any of the organizations if they require things of you, such as being vaccinated, such as having a background check, such as having to show proof of insurance. If you were driving, also proof of insurance if you're going driving, as well as your driver's license, whatever you need to do. If you're going to do things that are clinical, the people that run the clinic need to have to make sure they're not, letting somebody in who is a risk, who poses a risk to patients, to their health, their team, the people who work there, or anything else. So you do what they'll tell you to do, and you should be all right. If you decide you don't want to follow those rules, they have every right to have to say you can't work here, or you can't be around where we are over here, because we have to take care of our patients first. So just keep that in mind. I think that's really important to really understand that if you're entering the healthcare professions, we have a lot more things than just your own comfort level that needs to be taken into account.
Okay, so specifically liability insurance for clinical experiences. That's nothing to really worry about.
Yeah, I'm hoping everyone has some sort of health insurance too. Any sort of liability insurance should not be applicable to you, because you hopefully are not really practicing medicine or making decisions when it comes to someone's treatment plan or giving them certain medications or anything else like that. You should not be, maybe if there's something that you have to be covered under, hopefully health insurance should be fine. Liability, I don't think you need that. Again, check with the people who run the clinical experiences and just make sure they tell you what needs to be covered. Now, oftentimes, if you go into medical school and you're not vaccinated, I say, for example, I think it's Hep A, I think hepatitis, and certainly, you will be asked, if you've never had the hepatitis vaccine, that they will require you to go through the hepatitis vaccine, because it is super, super contagious. If you get needle stuck and you get hepatitis, just bad things happen to you. So they will pay for that hepatitis, vaccination sequence. Keep your records, obviously, for good reasons. But again, if you're doing any clinical experience, if they have any specific mandatory requirements, so you just pay attention to them and do them. You don't fret one way or another about it. If you have an issue with it, you may want to think about whether you're really pursuing the right career.
Cool. Makes sense to me. All right, Dr. Shuck, that was all the questions we have. Any final parting information to share?
So I think one of the things that's really important is issue of professionalism, and really getting an understanding of what professionalism looks like in a clinical setting. And I think many of you probably think you know what it looks like, but you get very surprised here and there. I pretty much believe that most people who are serious about going into medicine will take some class in medical ethics. But I think it's also just as important to see how the practice of the theory of medical ethics is actually, how does it actually look in a real clinical setting? So understand how safeguards are put into place so that everyone can act with integrity, everyone can act honestly, confidentiality is guaranteed, and those sorts of things. Pay attention to some of these things, because that's really bubbling up as a very solid area. I wouldn't say of a concern, but it is a criteria that I think most of the medical schools, and certainly a lot of the other health professions for sure too, really hold and cherish very much when it comes to evaluating an applicant. Do you really understand the issues of professionalism, and what did you see in any of your activities that shows a dedication towards the ethics and principles of professionalism as we understand it? If you look at the competencies for graduating medical students that I alluded to, there's an entire section on the specific characteristics and activities that one needs to be able to have observed in a graduate from medical school that shows that you have a very solid understanding of the competency of professionalism or something. So a lot of these things, I just want to make sure you know how to describe those activities when it comes to your essay writing. And again, that's something that I think people really don't do as well as they need to when it comes to describing their clinical activities. I get to see very vague things about this is what I did, this is what I did. What I don't get a sense of is, how important that experience really was, which, okay, you have the most meaningful experience side of things. But I also don't see that this was a significant enough experience that you actually paid attention to what the doctors did. You don't give me a sense of how many patients you actually saw, at least on a given day, how busy the clinic really was. These are things that I think are very measurable that fails to come through from a lot of people who write their work and activities for clinical experiences. They just basically say, oh, I just say I did this and this and this and this. And I'm like going, well, everyone's writing that. Everyone probably says, yeah, a shadowing experience is a shadowing experience. Of course it is. But I don't get a sense of, what you got out of it. I don't get a sense of how much you learned or how often you were able to see and really grasp the impact that the doctor had or the doctors had with a certain number of patients within the community. I think for a lot of people, you really undersell a lot of the clinical exposure that you've had. And as a result, it just comes as plain vanilla to any of us who are reading hundreds of thousands of applications of people talking about their clinical experience. And I think that's a frustrating point for so many people, because yeah, you've spent a lot of time. Hours mean something, but again, impact and your ability to reflect on what you saw, how it pertains to what you've learned about what being a doctor or being a physician or a healthcare provider is all about, is missing in a lot of the cases when people really describe their activities. So I really want to encourage you to, one, do a lot of journaling, but two, really take a really good look at, not what what the doctors have to handle when it comes to, managing patients, managing insurance, managing an entire team or working with the team, handling cases, doing all the documentation in order for you to legally, be able to say, what you were talking about, having to manage the pressure of being, being second guessed, because, plenty of patients don't trust you. They don't think that, you really have their best interest at heart. And you just kind of go through the whole process of, what do you really like about being a doctor? And why do all these doctors like being a doctor anyway? There's so much out there now in the literature and in regular journalism that says that, we're having a lot of doctors just thinking and second guessing why they want to be a physician in the first place. You got to really get to that point really soon to know that, that might be you in 30 years, but how did you get there? How would you get there, or how would you avoid getting to a point where you're utterly fed up with everything that's going on, and you want to just like become an influencer for the rest of your life, or do it, which is okay. There's plenty of doctors that do that. But if you really want to take care of patients, what is it about taking care of patients that really is your passion, that really makes you like be energized? I don't think we get a lot of people who can really discuss that. And I want to be fair. As incoming medical students, you probably don't have that depth to really discuss it, compared to when you really come out of residency and you really realize this is definitely what you want to do. It's a long process to get to that point of realization, and just do the best that you can to really convey your passion for working with patients and knowing and being in the role of the doctor in that type of a work setting. I know many of you want to be innovators, you want to do research, and you want to do that. Perfectly fine. We have plenty of doctors that do that. But the core basis, foundation of you going to medical school is knowing what it's like to work one-on-one with a patient or a caregiving team, or their caregiving team, and you understanding the navigation of the process of all the codes, of all the prescriptions you're going to have to write, and everything else that you need to know about understanding whatever a lab report comes in from doing a blood exam or whatever. So it's not as easy as just simply listening to somebody. You got to give us more than you being empathetic. And that's hard. I think that's what's really difficult about this process. So hopefully that will help you understand that.
Great. All right. Thank you for breaking that down. Dr. Shuck, thank you for taking the time to answer all these questions. Thank you to everybody that joined us. Hope everyone got something tangible out of this. We will be back on October 5th. And until then, see you all the next time. Dr. Shuck, have a good one.
All right. Thanks, everybody.
Have a good night.